Hello, I'm Sharon Spicer. I'm a pediatrician with Alberta Children's Hospital Home Nutrition Support Program and a physician co-lead of PEAS. Beverly Collison, PhD, is a speech-language pathologist and a clinician scientist in allied health and the Department of Pediatrics. She is a co-chair of the PEAS Standardized Practice and Education Working Group. Melanie Mathieson-Dewar is Unit Manager in the Viridel Children's Pain and Rehabilitation Centre at Alberta Children's Hospital, co-chairs the PEAS Roles and Implementation Working Group, and is a speech-language pathologist by training. We have no conflicts of interest to declare, and this work is done within our capacities at Alberta Health Services. We abide by the copyright rules of the University of Calgary. These are our objectives today: to define pediatric feeding disorder and its scope, and to introduce the PEAS project and its resources available for you and your patients and families with pediatric feeding disorders, and make you aware of PFD referral pathways within Alberta. We are going to provide you with a rapid-paced overview and hope you might then take the time to review more information available on our PEAS website, which is one of the resources we will highlight today. The Pediatric Eating and Swallowing, or PEAS project, is a provincial quality improvement project created in 2018 to standardize and improve the care of infants and children within Alberta who have pediatric feeding disorder. For this project, our target population has been children in the ambulatory care setting, and so we focused our resources on outpatient and community care. But many of these resources have been applied and adapted for other care settings, such as acute care as well. For this project, we have leadership provided through a steering committee, of whom the leaders are Natasha Teamstra, Executive Director, Ambulatory Care, Alberta Children's Hospital; Sean Hillhouse, her counterpart at Stollery Children's Hospital; Catherine Hill, Senior Operating Officer at Glenrose Rehabilitation Hospital in Edmonton; Julie Evans, Senior Practice Lead, Allied Health and Professional Practice; as well as physicians Justine Turner, a gastroenterologist at Stollery; myself, and Paul Beaudry, Chief of Pediatric General Surgery at Alberta Children's Hospital. And we've been led by an incredible project manager, Vanessa Steinke. I want to acknowledge that this project was possible through funding from the Maternal, Newborn, Child and Youth Strategic Clinical Network through a Health Outcome Improvement Fund grant of $375,000 over 3.5 years, and with support from the AHS Clinical Services Development Team. The PEAS project was awarded the University of Alberta Annual Innovation Award for the Department of Pediatrics in 2021 and the AHS CARES Award for Allied Health in November 2021. The project began back in 2018, back when we could all meet in person, with 2 World Cafes in Edmonton and Calgary, to gather information from multiple stakeholders, including patients and families, nurses and allied health professionals, physicians, administrators, and others on what was currently working and what was not working in the care of children with eating and feeding issues across the province. Using this stakeholder feedback, we identified the need to implement strategies for barriers and group the strategies into sections, including access and navigation, equipment and supplies, roles and implementation, standardized practice and education, and evaluation. I show the photos of some of these working group co-chairs, as you may know some of them. One of the tangible outcomes of this project is the PEAS website, which is a landing place for many of our resources. It's pretty simple, peas.ahs.ca. A priority for our project was to make the final products accessible to families and to care providers. So on this website, you will find both patient and provider portals and information on things like screening tools for PFD, finding services, clinical practice guidelines, and equipment and supplies for children who are achieving normal feeding milestones, as well as for those who have pediatric feeding disorders. Most of the information presented today is accessible on the website. So at this point, if you tune out from our speaking and simply navigate the website, we'd be happy with that outcome as well. Now I'll turn it over to Beverly, who will give us an understanding of pediatric feeding disorder.
Thank you, Dr. Spicer. Hello, my name is Beverly Collison, and I am pleased to be here today representing the PEAS Standardized Practice and Education Working Group on behalf of co-chairs Melissa LaChapelle, Provincial Practice Lead in Nutrition, and Vanessa Stanke, our Provincial Practice Manager. Over the next few minutes, we will explore a relatively new diagnostic label, pediatric feeding disorder. In January 2019, Gaudet and a representative panel of experts in feeding disorders published a consensus definition and conceptual framework for pediatric feeding disorder in the Journal of Pediatric Gastroenterology and Nutrition. In 2020, PEAS, with the approval from the MINT-C Strategic Clinical Network, adopted this definition as its foundational base. In a nutshell, pediatric feeding disorder is a common clinical diagnosis that is essentially the inability to orally consume an age-appropriate diet. According to the framework, pediatric feeding disorder should be diagnosed in the presence of dysfunction in one or more closely related complementary health domains, which I will describe in a moment. This new diagnostic paradigm requires the involvement of multiple disciplines and emphasizes a holistic understanding of the physiologic and functional impact of pediatric feeding disorder. This approach to diagnosis enables us to characterize the heterogeneous patient population of children of all ages and developmental stages with feeding disorder. Let's unweave the layers of pediatric feeding disorder. To start, it is comprised of two overarching components or sections. Section A of this definition recognizes the interplay of four multidisciplinary domains that are essential for normal oral intake at all ages: medical, nutritional, feeding skills, and psychosocial. A child with a feeding disorder may have dysfunction in one or more, or even all of these domains. The medical domain relates to impaired structure and/or function of the gastrointestinal, cardiorespiratory, and neurologic systems, including various neurobehavioral conditions. The nutritional domain includes malnutrition and dehydration, but it's important to understand that many children with pediatric feeding disorder do not present with malnutrition. Others might grow well and appear well nourished, but in fact have limited dietary diversity and risk of micronutrient deficiencies or rely on supplements to grow well. Some children with pediatric feeding disorder may have feeding skills difficulties, such as problems with deglutition and mastication. Psychosocial dysfunction refers to limitations or stresses in the child's interpersonal interactions and relationships around feeding. It is our responsibility as diagnosticians to carefully consider all four domains to understand how these domains can overlap when we see a child with an identified clinical feature of any one of the domains, so we can plan comprehensive interventions. For example, a child with a feeding skills problem may very well act out during meals and refuse to eat, but still has a feeding skills problem that should not be labeled or dismissed as only being a behavioral problem. Moving to section B of this definition, recognizes the verification that the feeding difficulties cannot be explained by families' cultural beliefs or practices, or by fear of gaining weight or body image disturbances that would be more consistent with an eating disorder. Last, symptoms can be further classified into acute pediatric feeding disorder and chronic pediatric feeding disorder. Prior to the publication of the Goudet and colleagues' pediatric feeding disorder consensus definition, highly variable classification and lack of common diagnostic code have made it difficult to state how common pediatric feeding disorders are. Our most recent frequency reports of pediatric feeding disorder come from a US prevalence study published in 2021 using ICD-9 and ICD-10 diagnostic and procedure codes from Medicaid and insurance databases between the years 2009 and 2017. This study's estimate of the annual prevalence of pediatric feeding disorder in US children is between 2.7 and 4.3% annually in children under 5 years of age. The annual prevalence increases to 20 to 33% in children under 5 years of age with complex chronic conditions. The authors conclude that more must be done by healthcare systems to ensure more uniformity in coding and earlier recognition of pediatric feeding disorder in order to provide early and comprehensive care to these children. This is particularly important for children with chronic health conditions where progression of underlying disorders concurrent with pediatric feeding disorder can be devastating. In 2019, and again in 2020, with the Pediatric Feeding Disorder Consensus Framework in hand, the American Academy of Pediatrics presented a proposal to the US Centers for Disease Control and Prevention, the CDC, for pediatric feeding disorder to receive its own diagnostic code. Their rationale included better epidemiological tracking, including prevalence and incidence measures, inclusion of necessary healthcare professionals in care provision, and advancements in research, such as identification, tracking, characterization of the disorder, and development of new assessment and management and treatment approaches. They were successful. Last October 2021, in the US, the CDC revised its R63.3 feeding difficulties category to include, on the slide in orange, you will see pediatric feeding disorder unspecified, pediatric feeding disorder acute, pediatric feeding disorder chronic, and other feeding difficulties such as picky eater. Alongside each of these new subcategories is recommended coding for associated conditions as applicable. For instance, aspiration pneumonia, dysphagia, gastroesophageal reflux disease, and malnutrition. What about Canada? CHI has logged a formal request to add additional coding for pediatric feeding disorder, the R63.3 series, for version 2025. In 2021, PEAS was among many health bodies that made a public submission request to help CHI better understand needs and rationale for inclusion of pediatric feeding disorder, unspecified, acute, and chronic. So what are we doing for the interim? A small provincial working group is working with Alberta Health Services terminology standards to create a SNOMED, which stands for Systemized Nomenclature of Medicine, clinical terms grouper that encompasses diagnostic codes for pediatric feeding disorder to ensure that children with pediatric feeding disorder are cohorted together appropriately while we await Canada's adoption of the CDC coding for pediatric feeding disorder. Our deliverable timeframe to add these SNOMED clinical groupers to connect care is by April 2022. I will now pass this back to Dr. Spicer. Thank you.
We'll now take a look at the tools available to support you when providing care to children with pediatric feeding disorders. The Clinical Practice Guide was developed to provide evidence-based clinical guidance to enhance quality of life and improve patient safety. These are pivotal to quality improvement in a field that has significant clinical and ethical complexity, and where very few guides and standards exist nationally and internationally. The guide aims to facilitate a consistent approach to the provision of care as close to home as possible, to facilitate communication and collaboration among healthcare professionals and with families by using consistent language, definitions, and strategies, to assist practitioner decision-making, to facilitate processes for quality improvement, to optimize quality of care, health outcomes, and psychosocial outcomes for families, and to offer clinician tips, tools, and training resources to support learning and education. It's 130 pages long, so we recommend bookmarking it and using the online version. I encourage you to take a deeper dive into the Clinical Practice Guide by visiting the PEAS website after this session. To find the CPG, on the PEAS website, click on For Providers, and then Read More under the Clinical Practice Guide header. Screening may identify the risk of a pediatric feeding disorder so that infants, children, and youth may be referred for a comprehensive assessment. Screening is not in itself diagnostic, and outcomes do not provide information about severity or best management for the difficulty. Expediting the identification of pediatric feeding disorder may prevent the development of conditions that negatively impact a child's cognitive, physical, emotional, and social development. Feeding is an intricate and complex skill that develops within a feeding relationship. Early detection and treatment of PFD may reduce adverse effects on caregiver-child relationships. PEAS recommends the Feeding Matters Infant and Child Feeding Questionnaire. This remarkable online tool is available for families and healthcare providers. It leads families through a series of questions that use smart logic to arrive at a risk statement for PFD. Importantly, as families and physicians work through the questions, each provides education about typical and atypical feeding and eating development. If any concerns are identified about feeding, you can follow up regarding next steps. There is a link to this tool on the PEAS website. There exist a number of published assessment tools designed to evaluate oral motor deficits and pediatric feeding and swallowing function. The majority of these assessments describe their psychometric properties in their respective technical manuals. Overall, the psychometric evidence of existing assessments is either inadequate or inconsistent, with limited information on the validity and reliability of these assessments. Most assessments should be used with caution. Recently published tools that show good validity and reliability include the suite of assessments from the Feeding Flock and the parent-reported Pediatric Eating Assessment Tool, or PD-EAT. just published by our colleagues at the Stollery, is a parent-reported outcome questionnaire for investigating swallowing dysfunction in healthy infants and toddlers, based on the concept of incorporating a patient and family in the medical decision-making. More details are available in the CPG. The CPGs have a lot of information to guide clinical decision-making as well. And in addition to the CPGs, the website contains other helpful information for families and clinicians. For example, coverage of formula costs can be found under Equipment and Supplies, the tab Formula, and the subsection on Formula Coverage. Another very helpful section is the Equipment and Supplies list, also, not surprisingly, in the Equipment and Supplies section. This includes things from plates and spoons that are friendly for little hands to specialty bottles for preemies or infants with cleft palate, specialty seating, and adaptive clothing for children with G-tubes to allow feeding access to the tubes. These products or vendors are not necessarily endorsed by AHS or PEES, but rather the lists are intended for convenience to show different products. In the very near future, families will also use the website to place their orders for formula and supplies with the home nutrition services in Edmonton and Calgary, and these orders will be linked to the patient through Connect Care. And now I pass it over to Melanie to show how the website can be used to navigate services for pediatric feeding disorder.
Thank you so much, Dr. Spicer, and hello, everyone. I'm pleased to be here today to present on behalf of the Access and Navigation Working Group, co-chaired by Patty Okrafka and Naomi Beswick, as well as the Roles and Implementation Working Group, co-chaired by Tricia Miller, Vanessa Steinke, and myself. So, on to the topic of access and navigation. As we know, connecting with the right care provider at the right time can be a huge challenge for families. PEES identified access and navigation as a priority area, and the PEES website has a section devoted to navigating the system to find services. On the PEES website, you can find all of these resources under the Find Services heading and the submenu on the left. Finding services within Alberta Health Services can be challenging given each program is named differently. PEES tried to address this by compiling a list within each zone. This list contains links to the Alberta Referral Directory, or ARD, which is Alberta Health Services' designated system for referral information, and it will tie closely with Connect Care. PEES also worked with clinics across the province to build as much consistency as possible into the ARD profiles in terms of referral pathways, eligibility criteria, and service descriptors. What you're seeing on the screen now is an example of what you would find upon seeking out a feeding service on the Alberta Referral Directory. For families, we also created a document outlining questions to ask and where to look if pursuing private practitioners. This information can also be found on the website under Other Providers and Services, and it includes links to various organizations where private clinicians might advertise or register their services. Another area of priority and focus for the PEES project is interprofessional collaboration and the roles of all providers to optimally support the child and family with eating and feeding concerns. The graphic on this slide really illustrates the goals of the PEES project with respect to building strong collaborative care teams and enhancing coordination of care and communication within the eating, feeding, and swallowing area of practice. The feedback from the PEES World Cafes that Dr. Spicer mentioned earlier indicated a disjointed current state, with teams separated by their discipline, by their geographical area, or even by their clinical program within the same site. Our goal is to provide teams with the evidence-based research and information and tools to help build care teams that are centered around the child and family, and that are operating under a shared goal of best patient care with fluid communication between all members of the team. We can truly promote the best patient outcomes via interprofessional care, bringing together the unique perspectives of varied disciplines, regardless of whether people work in co-located teams or are geographically spread out. As part of the Interprofessional Practice Toolkit, we have developed a diagram that addresses roles, as shown here, outlining the multiple and different care providers, for example, physician, nurse practitioner, registered dietitian, occupational therapist, speech-language pathologist, psychologist, nurse, lactation consultant, and others. This also shows their different training and skills, and the central and the pivotal role of the family in interdisciplinary care. We purposely blurred the colors between the professions, acknowledging that there are shared areas of practice among team members. The diagram on the left of your screen is the healthcare provider vernacular related to EFS roles, and the diagram on the right is created for family understanding of the various roles. Another tool in the toolkit is the collaborative goal wheel. PEAS has adopted and adapted the goal wheel as pictured here, which is a tool to facilitate creation of a collaborative care plan instead of one plan from each discipline. The center of the goal wheel is the family-centered goal statement, and a shared decision-making process is used to identify the actions or the tasks that will enable progress towards that goal. Actions or strategies are suggested by all of the disciplines involved to collaboratively support the child and family. The goal wheel pictured here provides an example of how we can document goal setting in a way that supports the collaborative process. The family and providers have a shared understanding of the overarching goal in the center and the actions or tasks. The goal wheel is a coordinated group effort approach to care. One final suite of tools we'd like to share is the feeding care plan templates, which are used in tandem with the goal wheel, with the goal of building consistency in reporting and information sharing. Having a clearly defined feeding care plan is an important part of safely managing pediatric eating, feeding, swallowing disorder or pediatric feeding disorder, and it supports the family and team in documenting a decision for the child's oral feeding and/or enteral feeding. It is an essential part of communicating and implementing safe and successful strategies across multiple care settings. For example, a grandparent's house, a daycare, or at school. The plans can be found on the PEAS website and can be used collaboratively by all disciplines on the child's care team, including the physician or pediatrician, who can clearly support the collaborative approach for safe care. We'd also quickly like to highlight the work that PEAS has done to foster a supportive peer network for families with feeding concerns. We partnered with the Alberta Children's Hospital Family to Family Connections program and are pleased to share that family peer mentors are available throughout Alberta who have experience with eating, feeding, and swallowing. They are ready to listen, share their experiences, and direct families to appropriate information and resources based on their own lived experience. We currently have an exciting 17 peer mentors across Alberta. Would you please consider helping us to recruit families who would either like to be mentored and supported or who would like to share their experiences as mentors to others? More information about this initiative can be found on the PEAS website under Finding a Support Network. And before we close off our presentation, we'd like to encourage each of you to consider subscribing to upcoming news and events through the PEAS website, as pictured here, and subscribing to our community of practice. The Alberta Health Services PEAS Community of Practice is available to all healthcare providers, including pediatricians and family physicians, interested in building community and to capture the spirit and harness the power of collaboration to enhance and improve interdisciplinary practice in eating, feeding, and swallowing care. And before we close off, a quick acknowledgement that this work has been and continues to be propelled by myriad contributors, such as those listed on this slide. They're from across the province and across our great health system, and we celebrate their influence on and continued passion for the goal of improving and optimizing collaborative, interprofessional eating, feeding, swallowing care. And a big thank you to you as well for listening into our presentation today. This brings us to the end of our information sharing time, and we do welcome your comments or questions. You can contact us by email at peas.project@ahs.ca.